and we're actually going to do it right now, Jennifer. We want to know how you monitor glucose levels at home, and we often see this machine. Absolutely. And so can you tell us how it works and what the patient is basically doing at home?
No, absolutely. So Amy and I are going to walk you through what a typical self-monitoring of blood glucose, or SMBG, is going to take a look at how that's going to work a little bit. So here we have a device that's pretty commonly recommended for patients to use their blood glucose monitor. The brand of the particular device is going to be changed based upon your insurance coverage, sometimes your particular healthcare provider's preference. So in this particular case, device here, we've got this land setting device and the glucose monitor, which Amy is demonstrating here for you. And then each of these land setting devices will be a little bit different. The one that Amy has, for example, here uses a drum that's got multiple of the needles in them, and they're usually quite small. This one allows you to have the flexibility of having up to 7-day checks. Each one of the companies, again, is going to be a little bit different. Sometimes
so it is
just
a prick.
Exactly. Okay. So this is a needled system where, yes, you do have to draw blood. As Amy can attest to, and I mean, she's been doing this for quite some time, it's not painful at all. The amount of blood even that a lot of these systems require is quite minimal now relative to what they used to be at one time.
Jennifer, how often do you have to be checking your blood? How many times a day? I mean, what is the range that you are looking for? What's that number, that key number?
Certainly. So in terms of a number of times per day, that's going to be fairly unique to each patient. And if they're on insulin, for example, let's say, they may be asked to check around their meal times, certainly when they wake up in the mornings, possibly when they're going to sleep at night. So that's going to be individually tailored to each patient. And so that might be, in the case of one patient, why they may go in and they'll pick up multiple boxes per month of the strips that go along with the device, because maybe they're testing multiple times per day, versus somebody that maybe is not being as aggressively managed because, maybe their A1C is still relatively well controlled, but the doctor still would like them to check maybe once or twice a day. That patient may just be simply asked to take a look in the morning and check to see how their glucose is responding to therapy.